Good morning, and welcome to the Professional Group Plans webinar series, Common Questions, Practical Answers. Professional Group Plans has partnered with Thompson Hine to provide a series of webinars that provide common questions that may be asked of insurance brokers and to provide some practical answers. These are designed to be short webinars, not more than half an hour, generally between 15 to 30 minutes, to give you sort of a heads up on how to address some of these common questions. My name is Kim Wilcoxon. I'm a partner in the Employee Benefits and Executive Compensation Group of Thompson Hine, and I'll be leading the webinar today. Throughout the webinar, please feel free to submit questions through the question box through the webinar. There's also a copy of these slides in the handout section of the webinar. You're welcome to download the slides from the webinar. With that, we'll go ahead and get started. Today we're going to talk about the ABCs of Medicare. Just to make sure everyone's on the same page, we'll talk about what is the difference between Medicare Part A, Part B, Part C, and Part D. Then we'll talk about what the basics are for the Medicare Secondary Payer rules. Then we'll get into our common questions. We'll talk about late enrollment penalties, Medicare and COBRA, Medicare and HSAs, and reimbursing employee Medicare premiums. Again, if you have questions at any time, please feel free to submit them through the webinar, and we'll address them as time permits. And of course, I have to provide the lawyer's disclaimer, which is that this presentation is not intended as legal advice or a comprehensive review of all legal requirements. Brokers should not attempt to provide legal advice, and employers should consult their legal counsel to confirm any obligations applicable to their business. That being said, let's talk about the ABCs of Medicare. Medicare has different parts. Part A is hospital insurance, generally inpatient hospital care, skilled nursing facility care, hospice care, home health care. In most cases, Part A becomes automatically applicable to folks when they reach age 65. That's not always the case, but in many cases it does. Part B is medical insurance that an individual must affirmatively elect. This involves coverage for physician services, outpatient care, home health care, durable medical equipment, and similar items. Part D also must be affirmatively elected by an individual, and that's prescription drug insurance. Part C refers to Medicare Advantage plans, which are generally all-in-one or some-in-one bundled plans that are offered as an alternative to traditional Parts A, B, and usually D. And then there's what's called Medicare Supplemental Insurance or Medigap insurance, which are optional policies that may be purchased by an individual intended to supplement traditional Medicare. So who is eligible for Medicare? Well, generally, Medicare eligibility is based on age or disability or end-stage renal disease. So individuals who are age 65 and older are eligible for Medicare. Individuals who are considered disabled under the Social Security Act are eligible, and individuals who have been diagnosed with end-stage renal disease are eligible. The Medicare Secondary Payer rules are designed to do a couple of things. One, it's designed to determine who pays first. If a Medicare-eligible individual is enrolled both in Medicare and an employer-provided plan, the Medicare Secondary Payer rules govern when the employer plan should be paying for expenses and when Medicare should be paying for expenses. They also impose rules designed to prevent employers from terminating, denying, or reducing group health plan coverage for current employees and their family members on the basis of the fact that someone's eligible for or enrolled in Medicare. And they prohibit employers from financially incentivizing employees to choose Medicare instead of an employer plan. Now, in some cases, different rules apply depending on the basis of Medicare entitlement. So if someone's eligible for Medicare based on age, these rules are going to apply to current employees and their spouses who are entitled to Medicare due to age. Disability-based entitlement is also for current employees and their family members. And then there are separate rules for end-stage renal disease, which apply only to individuals who are entitled to Medicare due to end-stage renal disease. There are exceptions to the Medicare Secondary Payer rules, so these rules don't apply to all employers. There's an exception under the age-based rules for employers with less than 20 employees. So if an employer has 20 or more employees on at least 20 calendar weeks during the current or preceding calendar year, so that's current or preceding, then that employer is subject to these Medicare Secondary Payer rules. Now, to determine whether an employer reaches that 20 employee threshold, you're going to count both full-time and part-time employees. And note, because it applies during the current or preceding year, the employer status could change at any time during the year. And so you'll need to take a look at, when is the claim being incurred? What is the status of the employer at that time? And note that controlled group rules apply. And we did have a question submitted through the question function about this. So any employer that's considered to be related to another employer through the controlled group rules would be considered a single employer. And we're looking not only at U.S. employers, but worldwide. So for example, if there was a Canadian company with 30 employees that had one employee in the U.S. Or that was related to a company with one employee in the U.S., we're going to add those together so we have 31 employees. So the U.S. company is going to be subject to these rules. Now, I will say that controlled group rules are very complicated, and in fact, they're a little different for Medicare purposes than they are for group health plan purposes. It actually encompasses more entities than the group health plan rules do. And we will be having a separate webinar on controlled group rules later this year. Now, the disability-based Medicare Secondary Payer rules apply only to large group health plans. So that's 100-plus employees as opposed to the 20-plus employees for the age-based rules. And here we're looking at the previous calendar year. We're going to look at full-time and part-time employees, and again, those controlled group rules will apply. Now, keep in mind, the age and disability-based Medicare Secondary Payer rules apply to individuals who are in, quote, current employment status. So the age-based rules apply to current employment status employees and their dependent spouses. The disability rules are a little bit broader and cover all dependent family members. When we talk about current employment status, we mean generally that a person is actively employed or self-employed or associated with the employer in a business relationship. So actively working. Now, individuals who aren't actively working are also considered to have coverage due to current employment status if they're receiving disability benefits from an employer for up to 6 months, or they haven't been formally terminated, they retain employment rights, and aren't receiving these additional benefits. So, for example, if you have an employee who is terminated and has elected COBRA, these Medicare Secondary Payer rules are not going to apply to that individual who has COBRA coverage. Or if someone continues to be employed by the employer, but has been out on disability for more than 6 months, then these rules would not apply. And just as a sort of the big items here that we need to think about are that the age and disability-based Medicare Secondary Payer rules prohibit group health plans from taking into account entitlement to Medicare based on age or disability. So generally, we can't treat someone differently because they are eligible for Medicare. And they determine which plan is primary. So if coverage is due to current employment status, the employer plan pays first. If it's retiree health coverage or COBRA coverage, there's not current employment status, then Medicare can pay first. So that's our overview of the Medicare rules. So we'll turn now to some common questions. First, let's talk about late enrollment penalties. I've heard that once I become eligible for Medicare, I can postpone enrollment without penalty as long as I have some type of employer-provided coverage. Is that true? Well, not entirely. And the answer is going to depend on whether we're talking about Medicare Part B or Part D, and it'll also depend upon what type of employer-sponsored coverage is available. So the basic penalty rule says that when an individual first becomes eligible for Medicare due to age, they've got a small enrollment period. So it's 7 months, beginning 3 months before the month they turn 65 and ending 3 months after. So it's not, 65 and after. There's a window around age 65. And individuals who fail to enroll or are not auto-enrolled during that initial enrollment period will be subject to penalties. And those penalties increase as they wait. The longer the delay, the higher the premium. So the penalty really means higher premiums when they ultimately do enroll and have to pay. Now, there's some exceptions. For Part B, employees and their family members can delay Medicare Part B enrollment without penalty as long as they're enrolled in qualifying group health plan coverage that's based on current employment status of the employee. So the penalty exception does not apply if the plan coverage is on the basis of non-current employment status. So for example, if an individual has COBRA coverage, remember we talked about the fact that COBRA coverage is not coverage due to current employment status. So if an employee terminates employment, elects COBRA, and continues on COBRA coverage, that COBRA coverage doesn't postpone the enrollment period for Medicare Part B for avoiding the penalty. So a lot of employees don't understand this. They think they can enroll in COBRA and still avoid the Part B penalty. That's not the case. They would need to enroll in Medicare within that initial enrollment window to avoid the Part B penalty. Now, assuming they continue coverage due to current employment status, then their enrollment period would be 8 months following the earlier of the termination of their employment or the termination of their group health coverage. So think about an individual who's age 65 and still actively working. That employee can continue in its employer-provided coverage until its employment terminates, and then we'll have an additional enrollment window to get into Medicare without a penalty. So here's an example. Let's say Bob turned 65 on March 15th, 2020. At that time, he's still working and has medical coverage under his employer's group health plan. Bob's terminated the following year, loses his active group health plan coverage effective as of his termination. Bob elects COBRA coverage under the group health plan. Bob has 8 months from the date of his termination to enroll in Medicare Part B without incurring a penalty. The COBRA enrollment does not impact the enrollment deadline for avoiding the penalty. Now, Part D is a little different. For Part D, employees and their family members can delay, and remember, Part D is the prescription drug, can delay Medicare Part D enrollment without penalty while they're enrolled in any creditable prescription drug coverage. And so creditable prescription drug coverage is coverage that's generally as good as Medicare coverage. Creditable coverage is not limited to coverage provided based on current employment status. So that means that COBRA coverage could be considered creditable coverage and could postpone the penalty deadline. Similarly with retiree coverage. And plan sponsors are required to notify participants about whether their coverage is creditable or not. That's that notice that goes out each October. So individuals who retain creditable coverage can continue to postpone Medicare, and their penalty won't kick in as long as they go no more than 62 days without creditable coverage. So they've got a 62-day window after terminating their coverage to enroll without generating the Medicare Part D penalty. So here's an example for Medicare Part D. Joe turned 65 on April 4th, 2020. At that time, he's still working and has medical coverage under his employer's group health plan. Joe retires on December 31, 2020. Effective as of his retirement, Joe loses his active group health plan coverage and becomes eligible for and enrolls in retiree medical and prescription drug coverage, and that prescription drug coverage is creditable. Joe then has 8 months from the date of his retirement to enroll in Medicare Part B without incurring a penalty. But he can delay enrollment in Part D for as long as he maintains his retiree medical and prescription drug coverage. If he loses that coverage, he'll have to enroll in Medicare Part D within 63 days of losing that creditable coverage, or he could be subject to a late enrollment penalty. Moving on now to COBRA. Common question. I've heard that becoming entitled to Medicare triggers a COBRA election right. Is that true? Well, usually no. And that's because a covered employee becoming entitled to Medicare can be a COBRA qualifying event, but only if it causes the employee to lose group health plan coverage. Remember that COBRA kicks in only when a qualifying event triggers a loss of coverage. And in most cases, that's not going to happen because the Medicare Secondary Payer rules prohibit most employers from terminating group health plan coverage on the basis of Medicare entitlement. When could Medicare entitlement be a COBRA qualifying event? If there's an early retiree medical coverage plan that terminates coverage upon Medicare entitlement. Now, do employers have to provide COBRA coverage to qualified beneficiaries if they're eligible for Medicare? And the answer to this depends on timing. If an individual enrolls in COBRA coverage first and then becomes enrolled in Medicare, the plan can terminate the COBRA coverage. But if a qualified beneficiary enrolls in Medicare first and then elects COBRA coverage, the group health plan can't terminate COBRA coverage because they've enrolled in Medicare. Now keep in mind, these rules apply to enrollment in Medicare, what the rules call Medicare entitlement. Medicare eligibility is different. So simply becoming eligible for Medicare, simply turning age 65, doesn't trigger these rules. These rules are triggered only if somebody actually enrolls in Medicare. Are there other ways that Medicare entitlement impacts COBRA rights? Yes. Medicare can extend the maximum COBRA period. So if an employee and the employee's dependents lose group health plan coverage due to the employee's termination of employment or reduction in hours, so we've got an 18-month COBRA period, that 18-month COBRA period would apply. But if the employee enrolled in Medicare, and again, enrolled in, not simply became eligible for, enrolled in Medicare within 18 months before the termination of employment or the reduction in hours, then the employee's qualified beneficiary dependents would be eligible for a maximum period of COBRA coverage that ends 36 months from the date the employee enrolled in Medicare. So the employee doesn't get an extended COBRA period, but his dependents do. Moving on now to HSAs. Can I have a health savings account or an HSA if I enroll in Medicare? And the answer is, if you already have one, yes, you can continue it. So an individual can continue to use funds that have been contributed to an HSA even after they enroll in Medicare. However, the individual can't contribute to an HSA for any month in which they're enrolled in Medicare on the first day of the month. So again, note that HSA eligibility is impacted by Medicare enrollment, not just Medicare eligibility. So the fact that a person has turned age 65 in and of itself doesn't impact their ability to contribute to an HSA. They have to actually be covered under Medicare. But also note that Medicare can be automatic and can be retroactive in some cases. So an individual would need to be sure that they understand when they are covered by Medicare to understand how much they can contribute. Because if an HSA participant enrolls in Medicare in the middle of a calendar year, it impacts how much the individual can contribute to that HSA for the year. An individual can contribute to an HSA based on the number of months for which they were eligible on the first day of the month. When somebody's covered by Medicare on the first day of the month, they're not eligible for that month. So it reduces the amount they can contribute for the year. Now, can an individual use the HSA to pay for Medicare premiums? And the answer is in certain cases. If the individual is age 65 or over, they can use their HSA on a tax-free basis to pay for or be reimbursed for premiums for Medicare coverage other than Medicare supplemental coverage. Generally, HSA funds can't be used to reimburse or pay for healthcare premiums without being taxed on the withdrawals, but there are exceptions for these certain Medicare premiums. Now, can an employer reimburse an employee for the cost of their Medicare premiums? And this is a fairly tricky question. In limited cases, an employer can reimburse or pay Medicare directly for the employee's Medicare premiums. This is a lot easier for employers with fewer than 20 employees because we're not dealing with the Medicare Secondary Payer rules. Remember, the Medicare Secondary Payer rules prevent an employer from treating an employee differently based on their Medicare eligibility and prevent financial incentives to encourage employees to enroll in Medicare instead of the employer plan. So let's take a look at employers who are not subject to the Medicare Secondary Payer rules, these small employers. Here's one way that an employer could reimburse Medicare premiums. The employer needs to offer a group health plan to employees who are eligible for Medicare. The employer needs to make sure that that group health plan provides minimum value under the ACA. The group health plan can't be limited to accepted benefits, so it's got to be a major medical plan, not just hospital indemnity or a standalone dental or vision plan. The employee has to be actually enrolled in Medicare Parts A and B. The reimbursement is available only to employees who are enrolled in Medicare Parts A and B or D, and reimbursement has to be limited to Medicare Part B premiums, Part D premiums, Medigap premiums, or accepted benefits. So This is a type of reimbursement arrangement, though, that would be considered an employer payment plan or an HRA, which would be a group health plan under ERISA and the Internal Revenue Code. So if an employer wants to reimburse premiums in this way, they also need to think about the rules that apply to this arrangement as a group health plan. Now here's a different option. In this case, the employer offers a group health plan only to employers who are not eligible for Medicare, and they've excluded the Medicare eligible employees from eligibility. In that case, the employer can reimburse the employee's premiums for Medicare Parts B and D if the group health plan that's offered to non-Medicare eligible individuals is not limited to accepted benefits. Again, it's generally a major medical plan. If the employee receiving the reimbursement is actually enrolled in Medicare Part B or D, the reimbursement is available only to employees who would be eligible for the group health plan if they weren't enrolled in Medicare, and they're actually enrolled in Medicare Part B or D. The employee is allowed to opt out of and waive future reimbursements at least annually. And either the employee is allowed to permanently opt out of and waive future reimbursements upon termination, or any amounts left over are forfeited upon termination. And again, this type of arrangement would be considered a group health plan under ERISA and the code. And the last option available for small employers would be an ICHRA. This is the new type of HRA that was created last year to provide reimbursement for individual insurance premiums. So an employer can establish an ICHRA, or an individual coverage HRA, to reimburse Medicare and Medicare supplement premiums for current employees in a permitted class. So an ICHRA must be offered on the same terms to all members of the same class. And you see here at the bottom of the screen what the permitted classes are. We can't simply say that an ICHRA is available to, store employees but not corporate employees, or I'm struggling for another example, excuse me. But the permitted classes are listed right here. So as long as you're willing to say everyone in this class is not eligible for a group health plan and is eligible for this ICHRA, then you can create this ICHRA. However, anybody who's eligible for these Medicare premium reimbursements could not be eligible for the health plan that's provided by the employer. And in certain cases, minimum class sizes must be met. So it's entirely possible that an employer who wants to establish an ICHRA to reimburse Medicare and Medicare supplement premiums can't do so simply due to the numbers in their workforce. More detail on ICHRA is outside the subject of this webinar, but can be provided. Now, employers with 20 or more employees, again, we're struggling with this because of the Medicare Secondary Payer rules. So if the employer is not an applicable large employer under the ACA, they could establish a QSARA, a Qualified Small Employer Health Reimbursement Arrangement. But in order to offer a QSARA, the employer cannot offer any other group health coverage and must offer the QSARA to all employees with certain limited exceptions, not just those who are eligible for Medicare. And for larger employers, they could also offer an ICHRA, regardless of how many employees they have, if they establish an ICHRA and follow all of the ICHRA rules. So to recap, the Medicare Secondary Payer rules govern coordination of benefits between Medicare and group health coverage, and they limit employers' abilities to treat employees differently with respect to group health coverage on the basis of Medicare entitlement. Late enrollment penalties may be tolled, meaning paused, under some circumstances while employees are enrolled in group health plan coverage. Medicare entitlement, not just eligibility, impacts COBRA coverage in some cases and HSA eligibility in all cases. And employers have limited options for reimbursing employee Medicare premiums, and those options have strict requirements. At this point, I'd be happy to take any questions that come in. I've not seen any others come in through the webinar. So I'll give it 1 minute to filter in, and if nothing else, then we'll go ahead and terminate. And if you have further questions, feel free to follow up with your professional group plans representative, and they'd be happy to help. At this point, we'll go ahead and terminate the webinar. Thank you.